Lewy bodies are abnormal deposits of a protein called alpha-synuclein in the brain. Lewy body dementia, on the other hand, is characterized as a progressive disease. This means that the symptoms start slowly and get worse over time. The most common symptoms include a change in cognition, movement, sleep, and behavior. The relevant factors are age, sex, lifestyle, among others. A prevalence of around 10 to 20% of all dementia cases is considered. The affected areas are the limbic system, the brain, the basal ganglia, and the pituitary gland.
Mi nombre es Laura Ortiz Alguero y el día de hoy vamos a hablar sobre la demencia de cuerpos de Levy. Signs and symptoms. Visual hallucinations. Hallucinations to see things where they are not can be one of the first symptoms and often repeatedly. Bad regulation of body functions, autonomous nervous symptoms, high blood pressure, the pulse, perspective, and digestive process are regulated by one part of the nervous system. Then frequently is bad regulation of body functions, autonomous nervous symptoms, high blood pressure, the pulse, perspective, and digestive process are regulated by one part of the nervous system. Then frequently is affected by dementia of Lewy bodies. This can provoke sudden declines of blood pressure when standing. Dizziness, fall, loss of bladder control, urinary incontinence, and intestinal problem as constipation. Sleep difficulty can be a disorder of the sleeping behavior with fast eye movements, which can provoke activity physically your dream while sleeping. Sleep difficulty can be a disorder of the sleeping behavior with fast eye movements, which can provoke activity physically your dream while sleeping. It can cause behavior of the set push, kicking, screaming, and yelling with sleeping. Fractal inattention, episodes of drowsiness, long periods of observation in the space, long naps during the day of disordered speak are possible. Depression, you can fall on it. Empathy, you can lose motivation. Course of dementia. Hallucination starts, delirium and nightmares in the disorder of behavior during the stage of REM. However, regarding to moment, some patients experience slowness, while others hyperactive with urinary incontinence. The average people with this type of dementia live between 5 and 8 years. However, some live no longer than 2 years or as long as 20 years since the moment they are diagnosed until the time of death.
Hello, my name is Valentina Laguna. I'm a college student. Next week will make and the guide and the video on Demencias. Intellectual stimulation provides cognitive decline according to so many studies. Games, reading, proselyte, and intellectual activities can help preserve function and prevent cognitive decline. The cognitive decline is progressive but its magnitude is more than enough to impact the social and laboral area. Although there is no cure for dementia, we leave bodies mainly on the simple kind, improving which travel treatments. Cholinase inadvertently will be increasing the levels of chemical medicine in the brain that are thought to be important for memory, thinking, and judgment. This can help improving alertness and cognition and might reduce communication and other behavioral problems. Medication for Parkinson's disease might help reduce in the signs and symptoms of Parkinson's disease, such as muscular stiffness and slow movement. However, this medication can also increase confusion, hallucination, and disillusion. Your doctor might prescribe medication to treat other signs and symptoms associated with Lewy body, dementia, such as sleep and movement problems. Some of the non-pharmacological treatments are psychotherapy, which can help with movement problems. Occupational therapy can help in ways to the daily activity and more easily. Music or art therapy can reduce anxiety and improve well-being. Mental health counseling can help people with Lewy body, dementia, and their family to manage emotional and behavioral problems.